Dr. Tom Weida, thanks for joining us today. It's good to see you again.
Thank you.
People save up to go on their vacation. They make all these plans. And we want to talk to you today about one of the most important precautions they can take, and that's think about their medical well-being before a trip. What are some of the top of the mind concerns that you have before you plan a trip?
Well, first off, you need to know where you're going. And depending on where you go really influences how you need to be prepared for it. So say if you're going to most of the United States, you don't have to worry about water quality or a lot of other vaccines or disease.
Yeah.
But so many people are now traveling outside the country to remote areas. They're hiking up the Himalayas or rafting down the Ganges.
Yeah.
And so there you really need to be prepared with both vaccines and safety precautions to protect your health.
In fact, I know in Alabama it's very popular among church groups. They go on mission trips, and they not only go to faraway lands, but the most desolate part of those areas, and you really don't know, if you don't prepare ahead of time, what disease might already be there that you could be predisposed to getting if you're not careful.
Right, and so first off, it's very important to be vaccinated against things that you may encounter in those remote locations. And unfortunately, a lot of times what people will do is they'll wait until 1 week before they're going on their trip and say, oh, I need vaccines. Well, it takes most vaccines about 6 weeks for them to become effective. And so you really want to plan in advance and get vaccinated as early as you can when you first know you're going to be going on a trip to remote areas.
You're a medical doctor, not an insurance man, but if you were an insurance man, would you be pushing trip insurance and health insurance that you're sure covers you if you're in a foreign land?
Yes, trip insurance and particularly medical evacuation insurance is critical if you're going to a remote area, because believe it or not, the most injuries are not necessarily from infectious disease, but for accidents. You know, traveling in that weird car and bus and taxi is where you're at most danger of being injured. And in that case, you want to get out of that country quickly to where you can get good medical care.
And if you don't have insurance or an arrangement made before you go, that can be super expensive. I mean, thousands and thousands of dollars to get out of there.
Yeah, it may cost you upward over $10,000
Yeah.
to be evacuated. And it's interesting, I know my department chair was in China and he broke his leg and had to be evacuated. He did not have evacuation insurance, but fortunately we sent a faculty member to bring him back.
What do you know? Now, you don't want people to be overly paranoid about travel. It's a big old world and we ought to see as much of it as we can while we're living on it. Are there any places that you'd say, I wouldn't even go to that part of the country, or with proper preparation, could you go about anywhere in the world?
Well, I think if you're careful, you can go almost anywhere in the world, although I would pay attention to the state travel department warning list of certain countries that you may really want to avoid, particularly countries that are in conflict. But if you are going to countries, important to really look at water. Because water in most countries is not safe to drink or may be a problem giving you diarrhea. We're very fortunate in the United States. You can drink almost any tap water and be fine. But in many other countries, you have to be careful about the water. Well, that water can be in many different forms. One, they can give you bottled water. Be a little suspicious. Sometimes they fill up that bottled water with tap water, in which case, poor problems. Two, Americans like ice. Don't take ice.
Because it's made out of the water.
Because it's made out of the water.
Yeah.
Three is we say, oh wow, I want to eat healthy, so I'm going to eat salads and vegetables. Well, that's been washed in the water and may still have organisms on it and bacteria on it. So you actually probably want to eat a little less healthy in American standards when you go out, or wash that water in distilled water or bottled water that you know is safe, or water that's been boiled for probably about 20 minutes.
So don't trust the bottled water necessarily. Do you even recommend possibly taking tablets that you can put in water that would clean it up, or is there such a thing that's practical?
Well, you can put iodine tablets in, just like if you were camping, so that can be helpful. Okay. But again, I'd be real careful. Now, that's why probably beer and alcoholic beverages are sometimes a little more available and can be helpful. The alcohol will kill the organisms. And you certainly want, you could probably do with bottled drinks that, again, have been major brand names.
I know many of our viewers who are thinking about traveling would go, well, that's interesting, but I'm going to this place. I have specific questions about this place. You already mentioned the State Department. Is there any other service that someone could tap into to say, I'm going to this country this month. Do you have any advice medically for me? Can you provide any service like that?
Well, there are two places. One is you can check the CDC website for travel advisories and travel helpful hints. But we also here at University Medical Center have opened a travel health services clinic. And so that can really create an individualized plan for you for traveling abroad so that you get the right vaccines, that you get malaria prophylaxis if you need malaria prophylaxis, and that can help you with what kind of medications and supplies you should take on your trip depending on where you're going.
And how long should I access that information in advance of my trip? Several months would be wise?
I would recommend several months in advance to access the travel clinic. We have an online form for you to fill out in advance so we know exactly where you're going and we can research where what recommendations need to be done.
Is there a charge for that, or is that just a service you provide, or is it?
There is a charge for this because it's not covered under normal insurances. Right. So we do have to charge fee for service for that and do have to charge for the vaccines in advance because some of them, like yellow fever vaccine, can be very expensive.
Is that right? But much less expensive than treating yellow fever down the road.
It's much less expensive than treating yellow fever or malaria.
And a lot less painful, too.
And painful, yes, less painful.
Well, safe travels to all of our viewers, and I know that your advice will help them as they prepare for their trips. We appreciate it, Dr. Tom Weida.
Yeah, this is definitely a case where an ounce of prevention is worth that pound of cure when you're traveling internationally.